Hi, I'm Jessie with Ask Astanza, and today we're here with nurses Carolyn, Webb, and Holly Hashop, and we're talking about laser hair removal. So thank you both for joining us today. We did kind of touch on this, but why exactly would you recommend laser hair removal over waxing or electrolysis? Because we know that's another option that's pretty prevalent and, you know, in the same realm as laser hair removal as far as aesthetics and laser type of treatments go. What would you say to someone who was considering getting waxing done or electrolysis to convince them to get laser hair removal?
Well, we touched on the waxing. I mean, even when you have waxing, there are other side effects with waxing. You can get ingrown hairs. It is extremely painful, and the fact that you do have to allow the hair to grow out. You can't shave it in between. Whereas with laser hair removal, yes, when you have it growing out, maybe you have something, an event coming up, you can shave it in between. And so you can keep that smooth looking appearance as you're going through treatments. Electrolysis, I have not been so lucky as to experience that myself, but I've had girlfriends, believe it or not, back in the day before laser hair removal was popular, who had to have electrolysis, and I think their stories are even worse than waxing or the older laser hair removal machines. It's extremely painful.
And a needle and in each individual hair. I mean, how long would that take?
It does, because you do.
It takes very long, yeah.
The time, yes, it is. It's you have to hit each hair follicle.
Yeah, I don't have that kind of time in my day. I can like go and take an appointment during my lunch break, not a whole afternoon off. Like, golly.
I think I remember my girlfriend who was getting it done. They actually did sections. They did. It was not even like they would treat a whole area. It was like a section, like in a time frame, because that's how long it would take.
Can you at least like watch Netflix or something during that?
Back then, no.
You're right. You're right. Back then, no. But.
No, we didn't have your iPhone either, so we were talking. You know, so
how did we make it through? I don't know.
Exactly.
I'm just so thankful personally that I did laser hair removal. Waxing, I mean, it's also messy. Just
yes, it is. It is messy. For me, it comes down to the cost. They're both, you know. They're both effective to your pain level, but waxing is a continual cost that does not go away.
Right, for years.
For years, yes, as long as you don't want to have that hair.
Right, it's continuous upkeep, and for me, it would be the pain or discomfort of it.
Very painful.
Oof. No, thank you. But.
Well, and then when you have some patients
afterwards that some people get.
Correct. But I think on a medical standpoint is, you know, patients who have polycystic ovary syndrome, who would be getting waxing because they have that excessive hair growth in various places, you know, even along the face. For women, the face and the neck, you know, you don't want to shave that.
Right.
Do you want to wax that? That would not be comfortable. So in that instance, laser hair removal, I think, is amazing for patients who have that. And I treat quite a few patients.
That's awesome.
PCOS.
Yeah, great treatment for them.
Good, I love to hear that. So what advice would you give to practitioners or plastic surgeons, nurses, what have you, who are interested in purchasing a hair removal laser? Any words of wisdom, little golden nuggets of knowledge, anything like that? I
think touching on what Holly already spoke of, one, finding an excellent machine. And then also the service and the training that goes with it for the staff as well. Something that you can do your treatments quickly and effectively, as well as it being extremely comfortable for the patient, which definitely the MeDioStar hits all of those points with the various spot sizes, with the amazing cooling tips. Even, you know, just the laser itself, and then of course the service that you guys give with your medical engineers. So the J's. I think you call them the triple J's, right? The J team.
Josh, Justin, Jordan.
Exactly.
I'm not an engineer, but Jessie, I could be. Team J.
There you go.
Team J, that's y'all's name.
Yeah, we're the J team is what
exactly.
we're casually known in the office by.
But that's really important.
Yeah. And like you mentioned, you know, the cooling, the speed, all of those really great advantages that come with the MeDioStar. So you guys have both been performing some treatments today with the MeDioStar on other patients we've had, doing various areas on the body like legs and back and underarms. Having, you know, had that experience already using the MeDioStar, what were some of your favorite benefits and features of the device?
So I mean, I definitely was impressed with how large that spot size was on the XL monolith. I even went at the slowest repetition rate that I could go, and it still was a really quick treatment for legs. Also, with how big the handpiece is, it was really light.
Yeah.
So it did not hurt my wrist at all. It was not awkward or anything. So I was really impressed with that. And then I kept touching base with the patient, like, how are you feeling? Are you okay? And she was like, it's great. And I was just like,
love it.
What?
It's amazing.
Wonderful.
Yeah.
Yeah.
That's so good.
Definitely really impressed with those aspects of the MeDioStar.
Nice. And what about you?
The same. I mean, for me, I really love the cooling on all of the hand pieces. I have lately having to be using the dual, the light shear, and that is a suction cup that takes so much longer.
Right.
So this is so much quicker. I love being able to glide it, as well as being able to do the individual pulses, but it's extremely comfortable to the patient.
Yeah, that patient comfort, but also the practitioner comfort, like you mentioned. Like, those are two things that we personally love about the MeDioStar, because it's, at the end of the day, you know, we want to deliver the best treatment and care to our patients possible, but we also want to make sure we're taking care of our practitioners too. You know, they're the ones who are working all day with the patients and using the technology. So if there's features and benefits that we can incorporate into the lasers to make the practitioner's day run more smoothly and not give them, you know, a crick in their neck or a tired wrist because the handpiece was too heavy, then we know we're doing a good job, you know.
Well, you're definitely hitting all those bases, because that,
Absolutely.
with the lighter handpiece, but also the shortening of the time frame, because it's not even so much for the patient, but for the practitioner, because I've been stuck in some fun positions for long times where, like, you're at the end of the day and you're trying to straighten your back out and everything, because you're like, why did that take so long?
Right.
And just because, you know, the treatment just takes longer. So you definitely hitting those key points across the board.
It's cool.
Exactly.
Well, I'm so glad that you guys have had a good experience, you know, so far today using the MeDioStar and playing around and treating some patients. We are actually going to do a treatment here in a sec. Do a little underarm treatment for myself. I'm really excited. This should be my first laser hair removal treatment ever. You called me a unicorn the other day, I think, because I've never had a laser hair removal treatment. So I'm very excited, and I'm ready to get started if you guys are.
Yeah.
Absolutely.
Great.
Awesome.